Let's go to that one, a very, very important topic. And it's, again, underlining that comment that I keep saying that the pandemic is not so much a COVID pandemic, it's yet another tripwire into the pandemic of unrecognized diabetes and prediabetes. If you look at the Endocrine Society Conference for 2021, again, just a couple of weeks ago, they covered the experience of a New York City dedicated COVID-19 hospital center. They looked at 708 consecutive admissions. They were mostly Black. For those of who had glucose over 140, their risks were greater, whether they had a history of diabetes or not. Again, we'll talk about that in just a minute, but if their blood sugar was over 140 at the time of admission, they were more than twice as likely to be intubated. They were more than twice as likely to have to go into the ICU, and they were more than twice as likely to have kidney injury. If their glucose value was over 180 at the time of admission, they were 4 times more likely to die. Again, 2.7 times more likely to be intubated and 2.9 times more likely to end up in the ICU. Again, this is whether or not there was a diagnosis of diabetes. Now, there are a couple of issues. What's causing this? We can all only guess. One of the guesses would be, we keep saying, and we know 90% of people that actually have this problem don't know it. Well, that's true. There's also a chicken or egg issue. What does that mean? Well, which came first, the high blood sugar or the disease? When you start getting serious levels of disease, that trips off the hormones that increase blood sugar, cortisol specifically. So what's going on here? Is it people that don't know about their blood sugar and their blood sugar is high and they don't know it and they're at greater risk? Or is it that people that have more serious infection, they're tripping off their cortisol and causing increased glucose? The reality is we don't know that right now. Bottom line, manage your blood sugar. Why wait for a disease and hope for a cure? I used to be an ER doc. My name is Ford Brewer. I quit ER after a few years because it was just so frustrating. Most of the things bringing people into the ER are things that should have been prevented, including heart attack, stroke, number 1 cause of death, number 1 cause of permanent disability. People think that you're just going to have those and that they're not predictable. Both of those are wrong. They are predictable and you don't have to have them. Usually it's lifestyle. Lifestyle is more important than supplements and even prescription drugs and even stents and surgery. But the current times are tough. Major financial impact with the lockdowns that most states have been going through. We've been working on a way to make this much more affordable with a subscription process. And that's exactly what we're announcing today. We've got 2 levels. One is the silver membership, where you get access to our courses, a private webinar each month, and access to our supplement store and supplement recommendations and prescription. Or I would suggest even more so, the gold membership. You can get a script for a Freestyle Libre and find out what your blood sugar metabolism's doing on a daily basis. And you can get a lab order for inflammation, OGTT, and insulin survey. You can also get a 30-minute one-on-one with me. So I'm looking forward to seeing you. Cost is no longer an excuse. So if you're interested, go to go.prevmedheartrisk.com/prevmed-subscription or call us at 859-721-1414, 859-721-1414, or email us at myhealth@prevmedheartrisk.com. Looking forward to seeing you. Thank you.